Trauma Triage. CDC Field Triage Decision Scheme. There are 4 specific steps to consider during triage. Step 1. Assess vital signs and level of consciousness. They are good predictors of patients' potential outcomes. GCS, systolic blood pressure, and respiratory rate. Step 2. Assess anatomy of injury. Consider priority transport to a trauma facility if the patient is found with penetrating injuries above the knee, an unstable chest wall, proximal long bone fractures of 2 or more, extremity that is crushed, degloved, mangled, or pulseless, amputation proximal to wrist or ankle, pelvic fractures, skull fractures, open or depressed, and paralysis. Step 3. Assess mechanism of injury and evidence of high energy impact. Consider priority transport to a trauma facility if the mechanism of injury meets any of the following criteria, despite patient assessment findings in Step 1 and 2. Falls of adults over 20 feet, children greater than 10 feet, or greater than 2 times the child's height. For auto crashes, intrusion greater than 12 inches where occupied, or greater than 18 inches on any side. Partial or complete ejection from automobile, death in same automobile, vehicle telemetry data that indicates a high risk of injuries, pedestrian, bicyclist versus automobile, if they are thrown, run over, or an impact at speeds greater than 20 miles per hour, and motorcycle crashes greater than 20 miles per hour. Step 4. Assess special patient or system considerations. Consider priority transport to a trauma facility if the patient meets these special considerations. For older adults, 55 years and older have increased chances of injury and/or death. 65 years and older may present with shock if SBP is less than 110. Mechanism is low impact, ground height falls. In children, consider transporting all children to pediatric trauma. Anticoagulants and bleeding disorders. Head injuries may present with rapid deterioration. For burns, if there's no other trauma, triage to burn facility. Other trauma findings, triage to trauma center. Pregnancy greater than 20 weeks, and use provider judgment.